Hi, my name is Abida Abdullah. I'll be doing a head-to-toe assessment. I'm just going to look around the room just to make sure there is no paper or cue cards around. All right, so now I'm just going to introduce myself. My name is Abida Abdullah. I will be a nurse today. I'm going to do environmental check. So the oxygen is here, suction machine with a yonker. The bed is at the lowest position. The call bell is within reach of the patient. Okay. So I'm just going to gain your consent to do this video. Are you okay with this?
Yes.
Okay, and then I'm just going to observe the patient. There is no skin color is to ethnicity. I don't see any bruising or any redness. For privacy and the video's sake, we're doing it over close, but I would do the assessment on bare skin. Okay, so I'm just gonna ask you your pain. Do you have any pain right now?
No.
Okay, and if you did have pain, I would ask you on a scale of 1 to 10, what is your pain rate, and where was the pain located, and what type of pain? And then, and now I'm just going to state. So this patient came in admission with abdominal pain, and now it is resolved, and he's being discharged, so we're going to do a final head-to-toe assessment before he is discharged. Okay, so now I'm just going to assess. I'll ask you, do you know where you are?
Yes.
Where are you?
In a hospital on a bed.
Okay, do you know today's date?
Yes, 16th of April 2024.
Okay, and your name is?
Darrell Gopal.
Okay, I'm just going to ask you, checking your ID, what's your date of birth?
November 21st, 84.
Okay. So now I am just going to check your eyes on your pupils to see if they're reactive to light. So I would just ask you to look away from the light. Okay, so it's 3 millimeters, so that's normal. I'm just going to assess your upper extremities as well. So your chest is symmetrical. Your skin is warm to touch. There's no bruising, bumps, or redness around your skin. And I'm just going to ask you to test your strength. Could you just squeeze my hand? Okay, so it's bilaterally normal. And then I'm going to check your capillary refill, which is under 3 seconds, so that's normal. All right, now I'm just going to listen to your breath sounds, so your lung sounds, sorry, to make sure there's no adventitious sounds or crackles. So I'll go bilaterally. Could you breathe in for me? Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. And then to the side. Okay, so I see that you're also, your chest size is transverse to your back. I'm just going to check the ratio, if it's like 1 to 2, around here. Okay, so it seems normal. It's not, it's aligned and it's normal. And I'm going to palpate your chest as well to see if there's any bumps or bruises. Do you feel any pain when I press against your chest?
No.
Okay, and I don't feel any bumps or lumps, or I don't see any bruising, and it's normal. Okay, so now I am just going to assess your cardiac and your apical rate. Okay, so before that, I'm just going to check your brachial pulse. Sorry. then your radial pulse. Okay, so it seems normal. And before this, we did your vital signs. So your blood pressure, your temperature was 36.5. Your blood pressure was 128/56. Your respirations was 18, and your heart rate was 75, which is normal. Your oxygen level was 96%, so that was normal as well. And so now I'm just going to listen to your heart, your cardiac. I'm just going to do your cardiac assessment. Okay. So at first I'm going to listen to your aortic valve, which is the second intercostal space, which is the loudest sound. You would hear the S2 is louder than S1, but it's the loudest sound. And then your second intercostal space, the pulmonic valve, which the S2 is also louder than the S1. And then I'm going to listen to your Erb's point, which the S2 and S1 is equal sound, which is the third intercostal space. It's on the left here, third intercostal space. And then I'm going to listen to the tricuspid valve at the fourth intercostal space, where the S1 is louder than S2. And then I'm going to listen to the mitral valve on the fifth intercostal space, where the S1 is louder than S2. Okay, so it sounds normal. There's no skip or anything. Your apical sound is normal. Okay, so now I'm going to assess your lower extremities. Oh, sorry, 1 second. I forgot to assess your abdominal. Did you have any, so if you had any tracheostomy or anything at your upper chest, I would assess the dressing and make sure there is no discharge, or if there was, I would change your dressing and suction the tracheostomy if there is any discharge. So now, do you have any abdominal pain right now?
No.
Did you have a bowel movement earlier?
Yes.
Do you have any nausea, did you feel any nausea, vomiting, or do you have any diarrhea before?
No.
Okay, so now I'm going to listen to your abdominal sounds for 5 seconds. 1 sec. Okay, so I'll start with the right lower quadrant. I'm going to listen for 5 seconds. And then your right upper quadrant, 5 seconds. I do hear some abdominal sounds normal, since you had a bowel movement earlier as well. Then I'm going to listen to your left upper quadrant for 5 seconds. And then your left lower quadrant for 5 seconds. And I do hear normal abdominal sounds, so there is no absent sounds. So now I'm just going to palpate your abdominal area. Do you feel any pain when I palpate? So I'm feeling for bumps or lumps or any hardness to your tummy. Okay. Any pain here? Alright, so it is symmetrical, and it is to the color of your skin. There is no abnormalities or no discoloration, and I see no redness or bruising. So now I'm going to assess your lower extremities. So it's warm to touch. Your skin is warm to touch. It's symmetrical. I don't see any discoloration or any abnormalities or no edema and no thing. I'm going to check your pedal pulse on both sides bilaterally. Okay. Alrighty. And then I'm just going to ask you to test your strength of your legs. So just push back on my hands. Good. And then I'm going to check your capillary refill on your toes. It's under 3 seconds, so that's normal. And then, right? And then I'm going to ask you to sit up. Can you sit up on your high follows and onto the side of the bed? Okay, so I'm going to listen to your lungs at the back and assess your spine. So if I can just go across here, so I can see that your spinal line is symmetrical and there is no bumps or any abnormalities with your alignment. So I am now going to listen to your breathing. So I'll just ask you to breathe in for me to the point and out. Breathe in, breathe out. Good. Breathe in, breathe out. Same here. And one more. Okay, so I don't hear any crackles or any adventitious sounds in your back there, and it's symmetrical. So I'm going to feel warm to touch, and your skin looks normal, and there's no bruising or anything like that. So you did receive your medication from the doctor and the your pharmacy. We sent it to the pharmacy for you, your medication, and you'll be discharged soon with so I think physio already spoke to you, and so now you're going to be discharged later today. Okay.
Okay.
All right, thank you.